Hi friends, hello everyone. Welcome to India's #1 medical coding institute. Excellence in medical coding training and placements. Are you ready to master the art of surgery coding? Let's see today we are going to discuss about, uh, like some information on surgery coding. Like many of the coders are, worrying about like uh, to go under the surgery coding training or whatever the specialties. But let's begin with the surgery coding training, and hopefully this will give you a good information for your future career. So of course same day surgery coding, and which is presented by Krityan Academy. It's a #1 medical coding institute. We transferred the quality of knowledge to the students. Let's see, same day surgery coding is also called ambulatory or outpatient surgery coding. Many of the professionals think that these are all different, but it's not. It all are same. Same day surgery coding, ambulatory surgery coding, or outpatient surgery coding, all are same. So what exactly the same day surgery coding? Same day surgery refers to procedures, where patients are admitted, treated surgically, and discharged within 24 hours without an overnight stay. That means does not require, hospital admission. They can come in the morning and they can complete their procedure, which is surgery, and they can leave to the home. That's what same day surgery coding. So procedures, the surgeries are performed on the same day admitted and same day discharged. And that is called same day surgery coding or ambulatory surgery or outpatient surgery coding. So mainly this will be focused on outpatient surgical procedures, outpatient surgical procedures. And when it comes to this career growth, so from past 2 years, since past 2 years, there are a huge demands for, all types of medical coding jobs. But surgery coding in the next 10 years, there will be excellent career growth in India as well as globally. Yeah, definitely. We are going to get more, the packages, which are salaries. It will be, rise. Definitely you are having a good growth in surgery coding. Okay. So why it is that much, career for surgery coding? Yes, because United States of Revenue Cycle Management. That's what we are working for, right? US RCM process. United States of America Revenue Cycle Management. So here what happens, right? Like the healthcare providers who stay, financially healthy, definitely they will have a separate team, which maintains their administrative works like reports or financial process. Why so? Because that will be giving a good results of reimbursement to that particular provider. So that is one of the main reason. So for as an example, if I'm a surgeon, what I do, I will focus only on the surgeries, like how the treatment and the surgeries. I'll just focus on the surgeries. But the other teams, like as a surgery coders or the RCM people, will focus on the reports and they will convert that reports into codes, right? So that is a usual process. So I don't care about that because we have an excellent team. So they are working on this, all the claims and all this medical coding reports and submitting to the insurance companies. So definitely my responsibility is to treat the patient, right? So I would definitely focus on the patient surgeries. Okay. So that is one of the reason. And the future scope, if you see here, high demand in United States revenue cycle management outsourcing. We are getting more projects from United States. So that's the reason India remains a hub for SDS coding jobs. India remains a hub for SDS coding jobs. So those who are CPC or CCS certified coders can work for US hospitals, insurance companies, and multinational RCM companies. In India, we are getting the projects from, the hospitals, or from the insurance companies. But when you are working in the United States, you can also directly apply for to the hospitals. You can apply the jobs for hospitals or insurance companies. But India, we don't have that option. We have only option which we can work for multinational companies. You may get a doubt, so what would be the salary growth for this? Let's see in the next slide. So if you see here, the salary growth, that would be a current average salary, which is 3 to 4 LPA for freshers. That means for completed their CPC or CCS certification and looking for the job opportunities. Some companies will take the people who are, even though they are freshers, if they are having a good skill on a surgery part, so definitely they will hire the people and they will offer the package like 3 to 4 lakhs. That depends on the company. And certified coders, like this is also, of course, certified coders and those who are having experience, like from 1 to 3 to 4 5 years, they will earn 6 to 10 lakh per annum only. And senior roles, those who are interested to do the audit, and even if the people are having a good skills on the training, so they can become trainers and they can earn 12 to 15 lakh per annum or more, depends on that company. Okay, and even team leaders or managers, you can easily earn from 15 to 20 LPA. The only thing you should be having a knowledge, good knowledge in surgery coding. So definitely you can aim for these many packages. If you are interested in a senior role, okay, fine, you can go for this auditor apply trainers, you can apply for that. If you have a good communication skills as well as the subject knowledge, definitely you will be having an opportunity to, become as a team lead or a manager. You can see the here, it starts with 3 lakh and of course it's going to 20 LPA. Let's see what the books we are using in the surgery coding. So we use the CPT codes for surgical procedures performed in the ambulatory surgery center or same day surgery. Okay, so whatever the procedures they performed in ASC or SDS, we'll use the book CPT only. We'll use the book CPT. And we also look into the guidelines, like whether some procedures are, bundled procedures or unbundled procedures, because you may have some procedures which included in the surgical package. So that all the guidelines we are going to learn during the training program. And ICD codes, this is mandatory for all the patient types, even not only the surgery coding, it is also, uh, required for other projects, even IPDRG, whatever the patient report, ICD codes are mandatory. So we assign diagnosis codes that specify medical necessity, that justify medical necessity. For medical necessity, I can give you a best example. The patient is having a chest pain and the doctor ordered chest X-ray. Yes, the chest X-ray is performed because the patient is having chest pain. That's called medical necessity. That's called medical necessity. Why the procedure performed? What is the reason for that? We call it as a medical necessity only. And definitely we'll also, assign the diagnosis codes to that particular procedure codes only. Then we will be looking into the modifiers. What are the modifiers we'll be using for this, especially related to surgery coding? There are some 51 and 59 and 76. Of course, there are some other modifiers also, but I just give the example here. And place of service only. Place of service for surgery, outpatient hospital is at 22, whereas ambulatory surgery center is place of service 24. So what's the difference between these two? So I'm going to explain in the next slide what is the difference between outpatient hospital and ambulatory surgery center. Even what is same day surgery and ambulatory surgery center. The difference I'll explain you in the next slide. And if you're not following all these rules, definitely here you can see on the right side the risk and challenges. There will be a claim denials. If you are doing some errors in even the CPT coding or ICD-10, or even missing modifier, that leads to denials. So what is denial, sir? Denial is like, insurance company will not pay for that claim because of some reasons. They will mention that reason and they will submit back to the companies. For example, the surgeon has submitted an example, I'm telling you, 100 claims submitted. In 100, only 90 are fully paid and 10 are not paid because of some, the reasons like maybe disease code is missing or incorrect CPT code or modifier is missing, that causes claim denials, Sandy. If you all surgery coder is following all this appropriately, definitely the claim denials will not happen. The surgeon will be very happy. So compliance risk, even if you are not doing correctly, they will do audits and from the government side in the United States. If you are doing some like fraud, like over coding or under coding, over coding means you're claiming extra money from the insurance company. So that also triggers the audits and so which is compliance issue, that one. And for all these things, it will be a delayed reimbursement. Incomplete documentation also slows down claim processing. If there is no proper documentation, I will not code that. I will ask the surgeon, please update the report, sir. So that also, if the documentation is complete, definitely the claim will be submitted without any discrepancy. So these are the challenges, and these are the challenges. So let's see, like, what are the types of surgery coding? What are the types of surgery coding in the next slide? Here you can see. Same day surgery, we have a types of surgery coding. As already we are discussing about ambulatory and outpatient surgery coding, that is a SDS. Like for procedures where patients are discharged the same day, and patients are discharged same day. So which is same day surgery. And usually it's nothing but hospital outpatient department. Hospital outpatient department. In a hospital, outpatient will be there and inpatient will be there. Or for hospital outpatient, so we have a codes which is from the CPT book, and opposite to that, inpatient surgery coding. And the inpatient surgery coding will have a book called ICD-10 PCS, which is IPDRG coding. In that IPDRG coding, we are using inpatient surgery coding. However, based on the payment classification, there are different types of payments, and which is an ambulatory payment classification system that's for outpatient, and IPPS, inpatient prospective payment system, that is for IPDRG, that is purely for IPDRG coding. So it depends on the payment classification. Also we can choose the books, and but this ICD-10 PCS is for IPPS, inpatient coding. And this one, ambulatory surgery center ASC coding. So this one is a facility specific coding for surgeries performed in ambulatory surgery center. So surgery is performed in a dedicated center, and those are specialized in a specific procedures. Suppose if there is a XYZ center, which is, that is purely, they will treat only for the orthopedic treatments, orthopedic surgeries. If you have any gastric problem, they won't treat you because that center is exclusively for orthopedic procedures, Sandy. So those are called ASCs, ambulatory surgery centers. But the objective same here, same day admit, same day procedure, same day discharge. So when you go for ambulatory surgery center, definitely you will get these things, and it would be a low cost, and there will be a lower risk of complications, and definitely there will be a separate caring team and a personalized care team, especially for this ambulatory surgery coding. But this outpatient surgery or same day surgery, it is a hospital outpatient department. In a corporate hospital or in a big hospitals, you will see, right, outpatient and inpatient. So that's what hospital outpatient department. So these are the different for types of surgery coding. So anyhow, we will use ambulatory surgery, outpatient surgery, and same day surgery. We'll use the CPT book. Only for inpatient surgery coding, this one ICD-10 PCS, especially for the IPDRG coding. Okay, let's see some of the specialities, like what are the specialities in surgery coding. Here you can see. Same day surgery specialties, if you see here, of course, many of the people, you have cleared your CPC exam, right? In the CPC or CCS exam, you will have some basics of like 1 series to 6 series, no? So nothing but here, integumentary system. Because some clients will work only for integumentary system. Definitely that the requirement is for, they're looking for 1 series codes, which are nothing but integumentary surgery. So like different coding and the musculoskeletal system, and that will start with 2 series, and respiratory system 3 series, a cardiovascular system. This is also, the most high demand in the market, and the cardiovascular system. So we will see the heart procedures and arteries and veins procedures and related to that codes. Okay. And digestive system, urinary system, we have a set of codes separate. And female genital maternity care, hysterectomy, ovaries and delivery. That codes are leads from 5 series only. And nervous system. As I told you, one of the top one surgery coding is cardiovascular. The next one is nervous system only. It's commonly called as a neurology. So this one is also full demand, and you can earn more salaries in these two only. One is cardiovascular, other one is a neurology. And the other all are common, and we can easily learn it like eyes and ocular, adnexa, and auditory system. But please remember, cardiovascular and neurology is having a full demand in the market coming next to 10 years. Next, you can see here some of the common examples for your understanding. For example, there is a cataract removal. So we have a code, and also we'll give the ICD code for that. If the modifier is required, we can also add the modifier and like arthroscopic knee surgery and hernia repair. Here you can see, and colonoscopy with biopsy, and this is the code. And colonoscopy with biopsy, this is the code. Clear? So why I'm telling you all this is because during our 45 days of training program, the training duration is 45 days, or you can calculate into 45 hours. We are going to cover all these specialities, and so based on your interest, you can choose any one of the speciality for deep explanation. That means for more explanation on that procedures, but we going to cover every CPT code and every procedures like from integumentary to auditory system. Then you can become as a surgery coder. You can apply. You can also have the knowledge like how to code the operative reports. So we will also show you the documentation part, the operative reports, and we'll prepare interview questions and important questions. Okay. So the only thing you need to be understand the concepts. We will also provide you the recording sections, and you can access for 3 to 4 days, and you can listen that the recordings a number of times. So we do provide online and offline live sections. So our academy is like, Krityan Academy. It is a registered academy, number one medical coding institute. We provide online and offline live interactive sections. All things like we provide medical coding certification training, CPC, CCS, and specialty coding training, surgery coding, IPDRG coding, HCC coding, evaluation and management coding, anesthesia, radiology, home health coding, HCC coding. Every specialty we provide the coding. So we have a well experienced trainer, real world experience who are having 16 plus years of experience. Got it? For more information for a new batches, you can reach out to this number or you can send an email to this email ID. If you are in Hyderabad, you can always welcome to visit. And for the address, you can reach out to this number. So thanks for watching, and definitely we would request you to subscribe to our channel for updates, tips, and of course the training insights. And we're also going to provide you the job updates, industry updates. So don't forget to hit the bell icon so you never miss a section and the new updates. Thank you for your time. Please share and give a comment. Thank you all. Wait for the next video. We'll upload it. Thank you.